Jan Keener. I'm one of the PNMT instructors, and I live in Cincinnati, and I've had the good fortune of learning from and then teaching for Doug Nelson for the last 20 years. I wanted to tell you a little about the Head and Neck Seminar. I think it's one of the best places to really get comfortable working in the neck. The difference in the confidence level I see in students from Friday night until Sunday afternoon is really amazing. On Friday night, we talk about the anatomy and the bony landmarks that we want to be familiar with. For instance, when we're looking for the anterior tubercles, that's kind of an unusual one, and many people are sort of, well, is it here? Am I there? I know that everyone in the room by Sunday afternoon will be able to say anterior tubercle, boom, it's right there. And also because we spend time talking about endangerment sites, it's reassuring when we know what to avoid, and therefore we can be clear about what we can treat with confidence. In the seminar, we cover some muscles in the scalp, in the jaw, all the muscles of the neck, as well as some muscles down onto the shoulder and into the back that impact the head and neck. And we talk about stiff necks and whiplash, forward head posture, thoracic outlet syndrome, different types of headaches, the latest research into migraines, as well as specific trigger points for different types of tension headaches. For the new therapist, it's really a great way to become very familiar with the muscles. It's one thing to know intellectually where the SEM, for instance, is, but it's quite another to know that, all right, my fingers are on the clavicular head of the SEM, and I need to move slowly because the SEM has a slow response rate, and I'm treating this head because my client has headaches in her forehead or maybe has some dizziness after a car accident. Each muscle in the seminar really kind of gets its own chance to shine. We talk about what the muscle is and where it is, what it does, what the body looks like if the muscle is tight. And then one of my favorite things is we have a list of kind of clues or indicators that our clients might come in complaining about or exhibiting if this muscle is problematic. We also look at the nerve that could be compressed by each muscle, as well as which other muscles it works with. For the experienced clinician, there's just a wealth of information. We look at screening tests, red flags that might indicate more serious problems. We look at range of motion measurements, as well as look at muscle tests. An example of like a muscle test, we look at the differentiation between upper trapezius and levator scapula. You know, many of us, of course, are familiar with the client who comes in and says, okay, I've got this pain here, and then they kind of draw their finger up onto the neck and down onto the shoulder, which at first glance looks like it could be upper trapezius or levator scapula. We don't really know which one. With a simple muscle test, and we talk about why each of these muscle tests put the muscle on a stretch. So like we put them in this position to stretch the levator scapula. We put them in this position to stretch the upper trapezius, and then ask if either of those creates the pain that they were having. So within that 1 minute, we then have the information. Is it upper trapezius? Is it levator scapula? Is it both? Is it neither? All of these sort of things makes our treatment really efficient and very precise. Thank you for checking it out, and I hope to see you in the Head and Neck Seminar.